Hello, everyone. I'm Dr. Rohan, and it's my great pleasure to introduce Dr. Yashwant to all of you. He has secured rank 1 in the recently conducted INISS exam in the breast and endocrine division. Heartiest congratulations, Dr. Yashwant.
Thank you. Thank you so much, sir.
Why don't you tell us a bit about yourself and also tell us since when have you been using Marrow SS and your journey with Marrow SS, please?
Okay, sir. So I basically belong to Rajasthan, and I've done my MBBS from AIMS Jodhpur. At that time, also like for my PG, I've used Marrow app, and I've secured rank 12 in INICET also. So then I came to AIMS Delhi for my surgery PG, and here I've used Marrow SS for my final exams also. And for last 6 months, I've been using Marrow SS for this preparation of the breast and endocrine surgery.
Okay. So was this your first exam or did you appear for other exams previously as well?
In the last session, I appeared for the surgical oncology. Actually, we are not eligible for last to last exams, so I was not. My mind was not made up regarding the what branch to choose actually in the super specialty. So I gave the surgeon part. But now, then after I secured a rank of 10 in that, but then I didn't took the counseling part in counseling. I decided to go for breast and endocrine in the this session.
So a lot of postgraduates, the most you're exposed to is GI, and that is a natural inclination for a lot of postgraduates. For you, why was it breast and endocrine? Was it the unit in which you were working? Were they doing a lot of breast and endocrine work?
Yes, sir. In our unit, we are doing like our unit is specialized in breast and endocrine. We have a separate breast cancer clinic, MDTs, and in our weekly presentations also, we discuss everything cases about the NCCN guidelines and all every weekly. So, and my faculty is also Dr. Anita, Dr. Kamal Kataria. They inspired me a lot regarding the endocrine surgery, the intricacies of this case presentations and all. So I grew an interest in this.
Perfect. So you said that you had Marrow SS for the last 8 months. Can you run through the journey? Did you watch the videos? Did you utilize the app for your final exams as well in the university?
Yes, I utilized the like mainly I utilized the Marrow first in the final year of my MS for the university exams, and it was clearly helpful. I'm not a person like who can read books only books and then pass the exam. So either I
Right.
make my own notes or watch lectures of yours and the surgical oncology and the surgical gastro, and then I read the notes of that, and then I passed my exams. So I felt like yes, it's a good decision and it's a good platform. So in the last 6 months, I again bought the plan for the SS, and then I prepared for the breast and endocrine. So videos previously I've watched mostly. So then pearls and the question bank I focused more on this time.
So for the breast and endocrine part, anyone who's interested, what all resources would you recommend in addition to the videos which are there in the Marrow app? Would you recommend them reading any other books as well?
For breast and endocrine, yes, the Bailey and Sebastian, like they are very concise chapters on the thyroid, parathyroid, adrenals.
Mhm.
So I've also read them, and there are most of the questions are directly line by line from them only. So I would recommend Bailey and Sebastian only, and rest the Marrow teaches the most of the recent guidelines and all they are given in Marrow. Especially I have read in the surgical oncology videos, differentiated thyroid cancer videos. So they have dealt in depth with the radioiodine use and all. And the breast cancers are in your videos. Your videos are also there in the general as well as the surgeon part. So
Mhm.
breast, these are sufficient for the breast management. These are sufficient videos.
Okay. And what about the Qbank? Did you solve the Qbank in the Marrow SS app as well?
Yes, sir. I solved the Qbank not completely. I had a very less time for preparing. Like I decided 3 months back that yes, I'll prepare for this breast and endocrine only. Otherwise, I was reaching general surgery part also completely.
Okay.
So yes, I utilized the question bank, the endocrine part and the breast part. The breast part question bank. It teaches us how to go for a case scenarios rather than just line by line questions. So that helps a lot in the final exams.
Perfect. And what about the mock tests and the mini tests which were highlighted section wise? Did you get a chance to appear in them as well?
Many tests I've given for general surgery, sir, 2 and 3, to the test, and one mock test I've given. But then, as I said, I had very less time for revising books also. But books I have not read earlier in the final part, final exams. So then I focused
Mm.
more on books and the Qbank only.
And please shed some light on this year's INISS paper, the division between the specialty part and the general surgery part. What was it like? Because sometimes the general surgery part in INISS can throw a curveball to you, and sometimes it can be heavily weighted on a particular subspecialty. Was it similar this time?
So coming to this year's INISS, as there is a pattern in the INISS, 50 question from the specialty and rest of the 30 from the general surgery part. And most of the time, the general surgery part is composed. I've given two exams, so most of the time it is composed of breast and thyroid part only, the general surgery part. But this time it was slightly different. It was more focused on the whole of the general surgery part and the GI also, and one or two questions from the breast and thyroid only in the general surgery part. And in the breast and endocrine, it was an equal division, mostly breast and thyroid. Adrenal, only few, and breast men's syndrome, and these were also included in the equal composition.
Perfect. So post the theory exam, look, majority of it is decided in the theory exam. In the interview part, can you please highlight what kind of questions and scenarios were asked from you?
In the interview parts are the like I didn't have a chance to attend your mock interviews. I wasn't knowing about the mock interviews part,
Okay.
so I missed
Yeah.
that. But in the final interview, our faculty also guided us. In the final interview, they do ask about the publications we have, the all the
Mm,
whatever we have authored, whatever we have presented in the different conferences, and how much we are inclined to the research part. Then after they come to the few parts of the parathyroid localization, and then they focused on the genetic counseling part of the breast cancer in my session.
mhm. Okay. All right. Do they also sometimes they ask about the thesis also? Were you also asked about that?
They definitely asked about the thesis, what type, like what thesis you have done, where do you have published the
Hmm.
thesis or not published, and what were the results, how do you analyze. They asked in the details about the thesis part.
Perfect. So, Dr. Yashwant, somebody who's looking for NEET SS versus INISS, and say somebody is in second year of post-graduation, what would be your tips for them? How to first decide whether to go down the NEET SS route or the INISS route, and how to approach their studies in general during their MS?
I would definitely suggest I don't know the other person's perspective, but for me, as I've already told, I'm not a more of a book person. So I prefer they should buy a marrow plan. Obviously, they have a like wide variety of subjects. So whatever chapters I want to look, I can look into the if I want to look into the stomach part in detail. So more I can go for surgical gastro videos or the surgical oncology for the cancer part. So we have the all the concepts they can be cleared up well now. After that, someone can read the books also, so they would have a better understanding and the better marks in the theory also. And meanwhile, they'll also get a preparation part for the MCQs also. In the second year, I would suggest go for Marrow first for a platform. That will build a base for your exams, final exams, as well as both the MCQ part. Then after clearing your final, then you should go for the MCQ or the Qbank part. Also, definitely you should focus on the routine cases. Like in the
Mm.
INI also, most of the breast questions are the routine OPD cases, which we have discussed in the MDT part or the NCCN guidelines for the thyroids and all.
Perfect. So one more thing which I want to ask is that a lot of postgraduates they struggle with revising the content before an entrance exam because the content is huge. What were your revision tips and strategies? What are your revision tips and strategies a few months leading up to the exam which can help them as well?
So I always have this unique strategy of I do whenever I revise, first I finish the syllabus, then I would revise the second time. Once I'm revising when I'm going to the syllabus in the revision part, then I would note that some things are there which I don't know, or I know that after reading this again I will forget this time.
Hmm.
So I would write them in a notebook, in a separate notebook I've made for short notes type of notebook. Then I would write in that, and if it is related to breast, then under the breast heading I would write all the NCCN guidelines or all the markers or the trials. I would write in a single page. Then I would paste it somewhere in my room, and I would keep revising those. So now there are two parts of the content, one which I know, and I know I will remember this part even after reading after 1 month. Some part which I know I will not remember, then I have made a list, and I will kept on revising that. So that would cover the whole syllabus for me.
Perfect. I think so. That's an excellent tip which you've shared. And Dr. Yashwant, thank you very much for such an insightful interview and tips for students who are preparing for the exam. Once again, congratulations from the entire Marrow team. Any parting words for future aspirants?
Uh, I think I would part with these words that sir, the INI part. Most of the student don't fill the form of the INI. They go for directly the NEET only. But I think these are doable exams, and definitely you should go and try for this. As for breast and endocrine surgery, it's an emerging branch, and yes, I've also grown interest in last 5 6 months, and so definitely you can come here and do a good job in this and do a better research in this field also.
Perfect. Thank you. Thank you very much for your thoughts. Once again, heartiest
Thank you, sir.
congratulations. Thank you for taking up time and talking to us.
Thank you,
Thank
sir.
you.